Good evening, everyone. That was very natural. Everyone went quiet at the perfect time. It's such a pleasure to have so many of you here with us this evening. A very big thank you for joining us at Lanserhof at the Arts Club. I'm Francesca Oakham-White and I'm the founder of the Beauty Triangle. Now, this evening, we're really going back to basics, and together we're going to be exploring how to build a strong and stress-free body. After all, humans have an infinite capacity for growth and change and evolution, but as the world gets busier and life starts to move a little bit faster, I think we can all agree that future-proofing ourselves isn't just a priority, it's really becoming a necessity. Now, when we launched the Beauty Triangle 5 or 6 years ago now, it was with the intention to educate and empower our consumer audiences on all aspects of their health and well-being, and always from a holistic standpoint. But it was also very much to have the conversations that no one was having in this space, and in doing so, introduce you to some of the most sought-after experts from the world of wellness, so that you can make safer and better informed, this is going in and out, I'll have to keep shouting from time to time, so that you can make safer and better informed decisions. On that note, it gives me great pleasure to introduce tonight's brilliant speakers. We're joined by aesthetic doctor and founder of Italia Clinic in Surrey, Dr. Aggie Zatonska, venous surgeon and founder of the Whiteley Clinic, Professor Mark Whiteley, and finally, sport and exercise medicine doctor here at Lanserhof at the Arts Club, Dr. Bevin McCartan. And together they're really going to be exploring how we can build a more powerful physique, as well as discussing some of the newer and proven treatments and techniques that can reduce inflammation and combat stress. Always those two culprits, I feel, that creep into every conversation. Just before we get started, a few things. You'll hopefully have found a program on your seats, on your tables, and there's also a referral card on there. So if you'd like us to connect you with any of the speakers that you hear up here tonight, then you can just leave your details, indicate who you'd like us to connect you with, and we'll do all of that after the event. We'll have time for some audience questions at the very end, so please do save them up until then. And finally, we have an amazing goodie bag for everyone here. We've got a really fabulous probiotic and multivitamin from our friends at You're Looking Well, and also some goodies from Lanserhof in there, so don't go leaving without that. I think that's everything. That's definitely enough from me. I'm going to hand over to our speakers. They're going to say a very quick hello to you all, and then we'll get started with the main conversation. So Dr. Aggie, welcome.
Hello, thank you for having us here. It was a beautiful venue and a beautiful turnout as well, so that's fantastic. I'm Aggie Zatonska. I'm a cosmetic doctor at a clinic in Egham in Surrey, where I work with most focus and passion on regenerative aesthetic medicine. So yeah, looking forward to hearing how we can blend those topics together. It's always exciting.
They always do come together, even if it's not immediately evident to everyone. Mark, over to you.
Thank you very much. I'm Mark Whiteley. I was initially a vascular surgeon, then went into veins about 25 years ago by developing some minimally invasive techniques, which you've probably all heard of now. But we've kept going on. We've got many PhDs, research projects, etc. So we come from quite a hard science background, which is why I love coming to these things where we amalgamate all different areas of medicine and try to get answers for patients using it from personal experience, from what companies bring to us, and also looking at the right from the original cellular and physiological basis. But it's great to see you all here, and I hope we answer all your questions.
Thanks, Mark. And Bevin.
Hi, I'm Bevin McCartan. I'm a sport and exercise medicine consultant. So I started my career doing orthopedic surgery, and then thought, well, I quite like injuries, so I went into emergency medicine, retrained, and then came across sport and exercise medicine as a specialism. And by that stage, I'd started doing elite sport on the side, and so trained in sport and exercise medicine and did about 15 years of elite sport, and have decided now just to have a break and join this wonderful clinic, which is focused on health optimization and performance and longevity, which is a real interest of mine.
Amazing. Yeah, coming to Lanserhof at the Arts Club must feel like a holiday after working with all those professional sports players. Amazing. So you've met all of our panelists now. And so our first speaker is Dr. Aggie Zatonska. She's an aesthetic doctor, as she's introduced herself to you. But I'm really fascinated, Aggie, because you've been seeing patients come into your Surrey clinic for years now, and you've been treating all manner of aesthetic concerns. But what are patients really looking for now from their treatment?
When my new patients start, I don't know if you can hear me, I will speak loudly.
It's going in and out of it.
When my patients see me for the first time, it is usually because they start to lose control over certain elements of aging. And it's usually one last straw, it's usually what tips the scales, is one last thing, you know, one little line, one little more imperfection, and that's where they think, okay, it's time to speak to someone about that. So for me, this is a real opportunity a very unique opportunity to actually start to have a broadened conversation about what happens when we start to age and how we can age proactively. So even though those patients come to see me with something maybe a little bit more superficial, I try to use this opportunity and bridge the gap between what we consider a classic medicine, which is the management of disease, really, to start to talk about preventative medicine and things that we can do. So I think it's a real opportunity and responsibility to do that.
I agree, and it's interesting that you said people come in for something superficial, or as they might deem it, sort of superficial, surface level, but so often, and I think all three of you will probably find this in your respective specialisms, it always runs deeper than that. It's never just something on the top
of the iceberg, isn't it?
It's the straw that breaks the camel's back, as I think essentially you were saying. But do you feel that modern lifestyle, the fact that we are moving faster, we are trying to wear more hats, we are juggling more, we're working longer hours, but also there's this sort of focus on our mental health and our sort of looking after ourselves outside the professional world. Do you think that's driving a lot of people to your door as well?
Absolutely. We live under unprecedented stress, chronic, constant stress. The pressure of life at the moment, juggling so many balls and doing so many things and striving for perfection, that leads to chronic stress, and that affects everything. And if we add to it perimenopause, menopause, children and work stress, etc., all of a sudden it just becomes a little bit too much. So the first things that patients may come to see me is, I look tired, I'm changing, I don't recognize myself in the mirror, what's happening? So that's where we start to obviously address those issues, because those issues bother the patient, but also we address many layers on what's actually happening to our body. And I think we start to have those conversations and educate patients. And often patients come to us very educated, and they just don't know where to look for help. And
but sometimes it's what is it called, analysis paralysis. You can know so much, but you don't necessarily know what to do with that information. And you mentioned layers there, and you're obviously talking about more of a psychological layers, but also it strikes me that when we're talking about aesthetics, facial aesthetics a lot, we do talk about different anatomical layers and the importance of understanding how to address them. So you might have the muscle, you might have the fat, you might have the skin, but specifically thinking about the body and how to build a stronger body, why do we also need to take that approach, that sort of layered approach to the physique?
I think it's commonly understood now how we age in terms of facial aging and facial layers. And I think most practitioners and most patients understand that, this is a multi-layered process and certain layers need to be addressed, but it's exactly the same in the body. Yeah. So it translates directly. Actually, even more so, and even more importantly, we have to think about different layers. We have to think about, if we think about longevity, we need to think about about bone health, about muscle health. And I'm sure my colleagues will be diving a little bit deeper into that. But we need to talk about muscle if we're talking about body. Patients often come to me and ask, what do I do with cellulite? What do I do with the skin laxity? And yes, that needs to be addressed. But we also have to think about what happens to the muscle.
And what's underpinning all of that.
And what's underpinning, and about the framework, which is our bones. But it's so much more than that. Muscles take a crucial role in regulating inflammation, in preventing the insulin resistance, and
particularly as we age and we're sort of hitting that perimenopause or menopause, or having really good muscular mass is definitely going to do us well.
Estrogen is going to massively decrease the mass of the muscle, and then therefore the mass of the bone structure. And if we think about where we are now with the epidemic of osteoporosis, half of women over the age of 50 will in their life will have a fracture related to the osteoporosis. Third of men after the age of 60. So these are quite serious numbers. If you think about the diabetes or insulin resistance, that is related to muscle mass as well.
And another soon to be potentially epidemic will be the GLP-1 antagonists and the weight loss medications that are obviously also driving.
This is a huge topic now, because a lot of patients openly or less openly are using GLP-1, so all of the weight loss medication. And because we screen patients and we talk about this, and also they feel like it's a safe space and they won't be judged, they often admit that they are doing it. And often it's an online medication, often it is something that is not really related to a GP consultation, so they're not that aware of the potential risks. And my worry is that we will have even bigger problem and really an epidemic of osteoporosis and problems with muscle wastage, because that leads not only to fat loss, but it leads to a massive muscle wastage and therefore osteoporosis. So I think it is, again, this is an opportunity to educate patients and spend this time to explain that it can help and it can save lives and prevent cardiovascular diseases when we talk about obesity. But for patients with normal BMI, it can be a massive problem in the future.
I definitely agree. And on that note, muscle stimulation, you've mentioned the importance of building muscle, preserving muscle mass. What can you do in clinic? Because muscle stimulation is, it can be really valuable to help sort of women and men, obviously, in that way.
Absolutely. Oh, this is working now. So
it's always a surprise when it suddenly jumps back in.
Obviously, the main thing is the healthy lifestyle. So we need to talk about the regular exercises, healthy diet. This is the base of everything in terms of longevity and lifestyle medicine. And we have a lifestyle specialist in the clinic as well to advise about nutrition, about the exercise, etc. But often we have patients who almost feel like, I need a little bit of a boost, I need a little bit of help. And if that's the case, we use the HIFEM technology, which is the high intensity focal electromagnetic stimulation. It's a very
quite a mouthful, well done.
But that's the EM Sculpt Neo device that combines this electromagnetic stimulation with radio frequency. And we can use big muscle, we can use it on big muscles to increase about 20% the mass of the muscle, and therefore help to really stimulate.
And it's interesting because you can do it in such a targeted and localized way. It's literally isolating like your glutes or your calves. And for some people, I think also it's so difficult to build muscle in certain parts of the body. So it's really interesting that you can really accelerate that muscle gain.
It can be very targeted. It also helps patients postpartum, post-pregnancies, when they have diastasis recti, to just bring those muscles together without surgery. So that helps to in a more less invasive way to improve the muscle health. And therefore bone health, if you think about it a little bit deeper.
Yeah, exactly. And it's so interesting that there are so many of these technologies now which are almost becoming the non-invasive route to try and do potentially what only surgery has been able to achieve before. Another muscle that absolutely needs safeguarding as we go through life is the pelvic floor, and not just for women but for men as well. At what point in life do you think it's really important to start thinking about our pelvic floors and really starting to think about how we can go about strengthening that in a more proactive way?
For all women after pregnancies, that's 100% of women after pregnancy, the stimulation of the pelvic floor muscle is crucial. And for everyone who starts to experience a little bit of decrease in estrogen. because that will immediately translate into the weakening of the pelvic floor muscle. So I'm on a mission to make every one of my patients try to sit on a micella chair. You sit fully clothed, just like that.
Actually, it looks a lot like the
just
chair
like
that you're
that.
sitting on. It's not covered in blue velour. It's sort of more leathery, but
but it's blue chair. The patients sit fully closed, and it is so important. This is something that will eventually prevent issues with incontinence, with prolapse, it will improve sexual health for patients. Patients not often want to talk about it to start with, but having something like this in the clinic, right there in the open, and discussing that this is something we can actually help my patients with, women and men as well. It is surprising for a lot of patients, and they find it very, very effective.
And I think as much as it's brilliant for the postpartum, I think even sort of getting your body into a place where it's strong enough as well, and really sort of making it more resilient ahead of potentially carrying a baby. I sat on the MZL chair quite a lot before I had my son. At least I sort of, I don't know, preventative. I didn't sit on it enough afterwards probably, which I probably should have done. No, that's super interesting. I mean, more and more I think we're seeing aesthetic devices start to tap into wellness. So we have modalities now that are addressing anxiety and high cortisol levels and sleeplessness, insomnia. LPG endomology is a really interesting device, and you're sort of one of the first clinics, I think, in the UK to be using it and using its new protocols. So I'd love to dive into that a little bit and understand about what makes this device so relevant now to building that stronger body.
It is a brilliant way to tackle several problems, really. It's such a versatile device. It really helps us, sometimes starting from superficial problem, a little bit of cellulite, skin laxity. Patients just want to look a little bit, better before summer, and that spikes the curiosity. But then when we actually discuss what else can be done, and when they experience how relaxing this treatment is, it's actually fascinating what it could do.
But because it does have its origins originally in cellulite, I mean, back in the day, and it's been around for some time now.
It
was
the
go-to
for
cellulite
some time,
treatment.
Yes, it's been a very popular device in France, in Poland, where I come from, in many European countries, and more recognized here in UK, thankfully, because that's something that really helps to address many problems. So from treatment of the scars, obviously cellulite and skin laxity, as we explained, to the wellness protocol, which helps to relax the muscles that sometimes are very, very tense. And it's interesting to actually experience how this mechanical cellular stimulation, as it's called, how this little handpiece just glides over the body and almost like sticks to those areas where we have higher muscle tension, and how it relaxes it in a very consistent way. So it's super relaxing. Patients wear those beautiful wide body suits.
It's very Instagrammable.
It looks beautiful, and yes, as you said, it's very pretty. But the impact on stress, 50% reduction of stress in patients that had a course of 10 treatments, reduction of cortisol, 45% after 10 treatments, 19% after one session. That's significant number.
It really is, and actually you're right. I remember I had the treatment myself maybe a year or so ago, and it got stuck on this bit of my lower back, which is always the area that I carry tension. Every time I have a massage, it's the bit that makes me like jump out of my skin when they sort of get their sort of hand into it. And also it got stuck on my C-section scar. So it does go to show that it is manually breaking, I guess, the scar tissue down and stimulating the oxygen back to the area and the circulation.
So it helps with lymphatic drainage. It helps with, it starts to bring more oxygen to those tissue and remove the toxins from those areas. So it really helps with the blood flow. But it's such a nice experience that it does really lower the cortisol. Lowering the cortisol then improves the quality of sleep. So insomnia improves, and when insomnia improves, our immune system works better, and it's like this vicious circle of stress, muscle tension, anxiety, poor sleep, poor nutrition, and then weight loss, and it literally just circles like that. And if we can break it, it is very powerful thing to do that.
No, 100%. And I also think what's so genius is when you find a treatment that delivers on that, call it superficial level, aesthetic level, but also that has a deeper rooted impact, I suppose, on how you feel and how well you are. I think that's sort of really key, and that's what we're looking for now. I mean, you mentioned lymphatic drainage there, and I think it's interesting because, again, lymphatic drainage has been around for 100 years, but it's definitely having a moment again now. So why is understanding our lymph and really optimizing lymphatic drainage in the body so important to that longevity piece?
So we use LPG for improving the lymphatic drainage. We use pressotherapy as well to improve the lymphatic drainage.
Is that those inflatable sort of trousers that you wear, and it's those are amazing?
That helps with the swelling, with edema. It helps to kind of improve the circulation. That will lead straight to
keep you away from Mark's office.
Mark Whiteley is going to tell you about. So this is very, very important to improve the circulation, to improve the the oxygen, bring the oxygen to those tissues and remove the toxins, and patients definitely feel the benefit of it.
Is it always important to be trying to do these treatments in a clinical setting? Is there anything we can do from home to sort of help optimize?
Absolutely. In terms of improving the lymphatics, dry brushing, cold or warm showers, lots of water, staying really well hydrated, healthy diet, avoiding toxins, alcohol, etc. So
living life in balance, that really exciting thing that we all love to do. Yeah, it's so true. And final question, because you sort of dipped into it a little bit at the beginning. You do have a very loyal following for your injectables, and definitely in that regenerative space, we're starting to see more and more products that can stimulate the body, I guess, to produce sort of collagen and elastin and even fat now. Why is this so exciting, and what sort of areas of the face and body are you seeing really interesting results from?
So I was never interested in the trend of beautifications and changing, altering how patients look and changing the anatomy. My main passion has always been prevention, maintenance, and just tweaking slightly, obviously, improving our skin health and how patients look like, but in a more holistic way. So we have now such a plethora of fantastic treatments that we can offer patients. We can use biostimulators like polynucleotides. They are highly purified fragments of fish DNA, very similar to ours. So they just signal to our cells to start to produce more collagen, more elastin, more hyaluronic acid. So the skin not only gets to produce more collagen, elastin, and more hyaluronic acid, so it's better hydrated, but also it's down-regulating inflammation, and then we're back to the main.
And it's such a nice icing on the cake when you've stimulated the muscles and you've sort of improved the lymph system, dealt with the cellulite, then to sort of strengthen that skin and really bring health back to the skin that sits on top.
Exactly, because I feel like doing that, I'm not only making my patients look better, I'm improving their skin health. So this is something that's really beneficial for their skin. I see patients with eczema, patients with chronic dermatitis, patients with rosacea that really benefit from those treatments. Not only the skin looks better and the fine lines are diminishing and things like that, but also pigmentation, redness, so all the inflammation, underlying inflammation is coming down.
Yeah.
And that gives my patients really the reassurance that they're doing something that's really good for their skin. It's not just looking good, it's actually healthy. So that's brilliant. The other thing that we do a lot recently is we start to talk about the adipose tissue while we try to remove and control it everywhere else.
We want to get rid of the fat, and then suddenly a product comes in that's like, we can stimulate your fat, we can get it back.
Yeah, but we need to be very careful about the faces, right?
Yeah.
So we need this underlying, we need this subcutaneous fat to just look plump and full in our faces and not look hollow.
Especially if you're on the GLP-1s as well, and you have had that accelerated sort of rapid weight loss, and suddenly your face or your body is looking a bit more gaunt than previously.
And it's all of a sudden patients feel like the body looks better, but the face has aged. So I use biostimulators like Profilo Structura. This is the new Profilo that helps to maintain our adipose tissue. So it helps to prevent the volume loss from lateral face, and it doesn't give patients the overfilled, stiff filler look.
The very wide face sort of look, yeah.
It gives them, it still works within our normal anatomy. It just blends in very lovely with our own tissue, and it doesn't look like it doesn't belong there, basically. So my patients love it.
Amazing. I mean, it's fascinating what you can do, sort of head to toe, face, body, every single layer of the anatomy to really future-proof it.
That's
Any questions for Dr. Aggie at the end, please do save them up and we'll come to those later. But thank you so much, Aggie. So our next speaker is Professor Mark Whiteley, probably the most in-demand venous surgeon in the UK. There's nothing Mark doesn't know about veins and valves and arteries and whatnot. And it's very exciting to get him talking on the subject. You're wildly passionate about it, Mark, which is a lot to say for veins, actually, but you always make it fascinating. But tell us, because we're here to talk about how to build a strong and stress-free body, where does the venous system actually fit into that? Why is it so pivotal?
I think what's really interesting is how veins have had such bad press. I mean, even you half jokingly talk about veins, and everyone thinks about varicose veins, just varicose veins. That's because the NHS and private health insurers and doctors for many, many years have just tried to trivialise them. In the NHS, there's no experts in veins at all. There's no job called phlebotomist or venous surgeon. You are lucky if you see a vascular surgeon, that's an artery specialist. If you see a general surgeon, he does a bit of everything. Radiologist, there's no speciality. And because of that, there's no research in the UK apart from in our clinic and one or two other places that work with us. And we go around the world where phlebology's taken off, and it's just huge. And you know, when I go to conferences in the UK, I have to talk 20 years ago, just get people in the medical space to even understand what we're talking about. And when I go abroad to places where they've embraced it as a speciality, suddenly I have intelligent conversations with researchers. And to answer your question more directly, if you actually think how much effort and thought you all put into nutrition, you think how much effort and thought you put into drinking. You've already talked about lymphatics. You've talked about circulation. But the one thing you've got to do is you can only get all of these nutrients to the muscles and skin and everything if there's a return flow. So if you have venous, if the veins aren't bringing the blood back, then your microcirculation is not going to get there. So you can put whatever you like into your body, but if it doesn't get to the cells because the actual outflow isn't working, and all the, as you call toxins, but metabolites, carbon dioxide, urea and everything else, if that's just sitting in the tissues because your veins aren't functioning properly, you're going to have a build-up, and you're just, whatever you're talking about, whether it's a hormone-producing thing like your ovary or your thyroid, whether it's your skin, or whether it's your pelvic floor, whether it's muscles, you're just not going to get the second half of the circulation. So it's basically useless.
That's so fascinating. Nobody's ever really explained it like that to me. You know, that they're pivotal to affecting everything that we're trying to address in the body.
And that's purely and simply because it's not taught in medical schools or nursing schools or anywhere else, because veins have just been thought of as varicose veins and nobody wants to treat them. When you get leg ulcers, pelvic congestion syndrome, all the other bits and pieces, defense Roberts and everything, that's something else. They don't sort of relate it. If you think of your body, there isn't a single bit of your body that doesn't have a venous drainage. So it's everywhere. Everyone talks about the circulation and they only think of half of it. They only think of blood getting there. Just think about the road network. If you only thought about lorries getting to a town and didn't think about how they got back again, you'd have a lot of problems.
You'd soon know about it. Yeah, exactly.
So,
It's very interesting. Somebody said to me recently, researchers in their given fields are always, on average, 7 years ahead of what the NHS is doing, which is fascinating. And maybe it's even more than that, and that's why it's so interesting to have this conversation with somebody such as yourself, who has really pioneered so many interesting techniques and treatments that have gone on to become gold standard when it comes to treating veins, because to your point, sadly you just won't necessarily get the same intel and support on the NHS. In many areas of health, it's the same with menopause. There's no menopausal training when it comes to sort of studying medicine.
Absolutely, and it's not an NHS versus private thing, because the trouble is almost all private practices are NHS doctors moonlighting. So they're taking their lack of knowledge to the private sector. So until you look at actual places that do the original research, and if you look at normal things where the NHS does it, so I'd hate to say speciality, but a speciality where there is an NHS specialist and then you look at the researchers, I think at 7 years is probably about right. In veins, there's no NHS equivalent, so they're not even trying to keep up. So it's about 20 years at the moment.
Yeah.
But unfortunately, in most private clinics as well, and private hospitals, those NHS doctors bring that same lack of information. So they still talk about just 2 veins in the legs.
Yeah.
They ignore, as we know with pelvic congestion, for poor women with gynecological problems and pains, they get told they're mad or they got endometriosis, whereas we know 1/3 of all women with pelvic pains have got pelvic congestion, varicose veins in the pelvis. So venous disease is just ignored.
Yeah, absolutely. And I want to touch on pelvic congestion later because I think it's such an interesting subject and it's something that not many of us really know a huge amount about. But it strikes me that a lot of people, and Aggie and I spoke about this as well, they come in for the aesthetic symptom of having the vein. Maybe it's thread veins or spied veins that suddenly are starting to look quite unsightly, or the varicose veins. But I think you said to me there's 90% of women who present with that actually have an underlying condition. But are more of us coming in for aesthetic reasons than the functional, and does that need to be addressed?
It's very difficult. So there's 4 main areas at the moment in venous surgery. So you've got legs, you've got pelvis, then you've got leg ulcers, which we try to separate off, and then you've got what we sort of call aesthetic veins, or veins that people don't like the look of. And that's sort of the way the venous world is shaping up at the moment. So it really depends which one of those areas you're looking at. I think if we talk about legs, because that's obviously the commonest, most people who come to see us, if they've only got thread veins, the research shows very clearly that 90%, as you say, have an underlying varicose vein problem, and 45% have a problem that if you don't fix will go on to cause swelling, leg ulcers, etc., going in the long term. So if you ever go to anyone and you with an aesthetic problem in your legs, you don't like the thread veins, and they're not doing a scan first, you should walk out. Because
that's fundamental to
absolutely
seeing what the root cause of that. Otherwise, you're just addressing a symptom every time.
Absolutely right. And I mean, we've got some lovely patients. I've got a lovely man in my Bristol clinic who came to see me, and I think I've told you about him before. And he was 52, and he had this great big leg ulcer. And I sort of said to him, how can you let him get to that? And he said he's been to his GP for his annual checkup every year. He pays him privately to see him. And over the years, he sort of said, those little veins are, I've got worse than that. Then when they got a bit bigger, I've got worse than that. And then I've got worse than that.
It's like a one-upmanship. Whose veins are worse?
And then, so he never referred him. And then when he actually he went from 32 to 50. And when he eventually got his venous leg ulcer, the GP's mind switched and he said, now you have to see the nurses for honey and dressings. Because he didn't realise it's the end product of venous reflux disease.
Can I ask, what are the symptoms that we should all be very attuned to when it comes to the veins? What are the things that we should really be picking up on and going, I need to go and get this checked, and I probably need to have a scan, to your point as well?
So the nice guidelines have put this out. So in the legs, it's well known now, because pelvic congestion, I think we'll come to later, and that's different. So if you just think about the legs, what the nice guidelines say is if you've got varicose veins, but the trouble is half the people with varicose veins don't even know they've got them because they're hidden underneath. They've got hidden varicose veins, so you've got to ignore that, really. So the symptoms of venous reflux disease, or hidden varicose veins or varicose veins, are first of all a tired leg, an aching leg, or a heavy leg. If you've got pain in your leg, that actually means you've got a clot or something else. Varicose veins do not cause pain, but for years GPs said, it's not painful, I'm not treating you. But it's an ache, heaviness. If your legs feel better when you put them up at night, that's a real sign. You're already into what we call C2S, which is varicose veins with symptoms. Then if you've gone the stage further, you get swollen ankles. Stage further, you get some red marks or itching around the ankles, usually, or lower legs. Then you get brown stains, and the next thing's leg ulcers. And it's a progression. Leg ulcers don't magically appear. It's a progression of disease in legs. On top of that, we also have a lot of patients at the moment who, because the NHS is reducing its funding for veins, and so is our private sectors for years, we're getting more and more people who are now turning up with bleeding veins. They're standing in the shower. I put a YouTube video up of one young lad. He's only in his 30s, and he suddenly saw it, and his blood is just shooting across from a tiny varicose vein. And when you scan him, of course, he's got huge veins on the inside, but he'd only ever seen a little blue bleb. And of course, clots, that's the other thing that everyone's worried about, but you have clots in the deep and the superficial system. So about 30 to 40%, so half of you in this room have got venous disease, whether you know it or not.
Oh my gosh, that's so sobering, isn't it? I need to book a scan with you immediately. That's Yeah, that's quite terrifying.
It is.
But so once you've had the diagnosis, once you've had your scan and you've identified that maybe there is a sort of faulty valve that needs addressing, what are the treatment options? You've created a lot of them yourself, but what could we expect to be signing up to essentially?
So the first thing is the veins don't go from your foot to your groin; they go from your foot to your heart. But all doctors like to just treat the legs because that way you don't get into the messy stuff inside. So they ignore all the veins in the pelvis and all the veins in the abdomen. But that's part of the problem. So the first thing is you have to go to somewhere where you're actually going to do a proper scan. And that doesn't mean just the legs. It means if there's veins coming from above, it's the pelvis as well. To answer your question, because I could go on for ages, as always with veins, there are 3 different areas of venous disease. The venous reflux is the easy one everyone understands, which you stand up, the valves don't work, blood falls down. Venous stasis is when you just don't move or the veins aren't able to pump the blood away because of the valves not working. And obstruction means that there's a blockage. But the biggest one that we talk about tends to be reflux causing stasis. Now, endovenous laser ablation of the truncal veins is what you'll see most about, maybe radio frequency. The newer things coming out is microwave, and the very latest one that we've had with the only place in the country that's got it at the moment is non-invasive technique called sonovein, which is high-intensity focused ultrasound, where without any needles you can actually focus ultrasound through the skin and actually to close the vein.
That's going to be wildly popular because otherwise you've got sort of tiny little fibre optic sort of lasers and sort of all manner of devices snaking up the veins, haven't you, internally?
That's right.
Sorry, I don't do it justice. You could probably say it far more eloquently than that.
I think that's far more eloquent than I could ever say it. I think it's quite nice. The thing is, what people get very worried about closing veins. They say, oh, you need veins. What happens when you close them? But of course, the most important thing with this scan is you're finding the veins that aren't working and are working against the system. So it's a bit like closing holes in a bucket. You're stopping blood falling back down the leg when it's being closed. So we're just trying to find ways to close veins. And one of the most important things we've found is if you cut a vein and tie it, it will just grow back again. It doesn't work. So removing veins doesn't work. And when you remove a vein, what ends up happening is it grows back again. And when it grows back, it doesn't have a valve. So it's not only painful and scarring, it just doesn't work. So everything we do nowadays is about closing the vein in situ, killing the vein wall, make it shrivel away, so it's just not there in the long term. But the key to that is all of these techniques you can either over or under treat, and then you get other problems. So it's the understanding the tissue that you're treating and exactly whether you use heat, chemicals, or prostheses, how you're going to close them in the permanently.
I think it's just another argument as to why you need to see a specialist for treatments such as these. Can you tell us a little bit about the pelvic congestion? So these are sort of veins running through the pelvis that, again, would probably go otherwise undiagnosed, but it sounds like they can have a real sort of impact on lifestyle, general wellness, health, sort of in the long run.
Yes, we've actually had a bit of a interest from the press, and I think we've been in several things like OK magazine. There's one coming out in the Sun soon about patients of ours who we've had some actresses who literally can't stand up for more than 30 minutes because they get such pain. We've had people who find sexual intercourse too uncomfortable. We've had people who are infertile who become fertile once you actually get the circulation working. We've had people who have been told they've got to have hip replacements. And then when you fix the pelvic congestion, the hip pain's gone. So basically, any pains or aches in the pelvis, including irritable bowel, irritable bladder, can be due to pelvic congestion syndrome. Pelvic congestion syndrome, if you look at the old stuff that's out of date, says it's only in women, and it's only in women who've had children who are still fertile. That's been absolutely blown out of the water. It happens in any woman at all, and it also happens in men, which blows out the fertility bit of it. 25% of our patients are postmenopausal, and 10% have never had children, and that's the ones we've diagnosed. Research now, we started shouting, I started shouting about it in 2000, got to about 2003, 2004, not many people talking about it. At conferences, people started talking about it in 2010, and now this whole conference is just on pelvic congestion itself. And the simple way to think of it is varicose veins, but inside your pelvis. And it's as we talked before, it's the inflammation. It's the fact that blood falls in these veins, sits in the pelvis, doesn't move, and then you get inflammation. The same way in your leg, you get a leg ulcer. If you get inflammation in your pelvis, it irritates everything there. So it irritates a lot of women who think they've got stress incontinence, actually, or this thing, interstitial cystitis. Everyone keeps on talking about interstitial cystitis, and they can't get a bug. They can't find anything in the wall. They're not looking on the outside. An awful lot of these women, if not most, and men have got varicose veins on the outside of the bladder that's causing inflammation, irritating the bladder, and they're going in, and all these urologists and gynecologists, they're looking inside the bladder, oh, there's nothing here, they're taking biopsies, if they just did an ultrasound with a transvaginal ultrasound, they'd see these great big varicose veins sitting on the back, and then you could see why they're coming and fix those. And the treatment for that is, because it's internally, we use metal coils and foam sclerotherapy, which blocks those off. I've invented a new technique, which unfortunately hasn't got through FDA and everything yet, so it's not quite available.
Watch this space.
Which will actually block these veins off without leaving metalwork behind, and that's going to be huge. But as I say, I've just had last week, actually, I had a man fly over, a medical student from America, only 20 years old, terrible pains in his pelvis. I mean, he's gone through, everyone thinks America's great, but medically, not always, and he's had every test they can do over there. And they've just said they've found a bit of inflammation in his prostate, but they can't understand why he's got this pain in his penis on the left side of his pelvis. So he came over, we examined him, and he's actually got male pelvic congestion, and he's got a vein which is actually causing stasis and reflux in the left side of his prostate.
Wow.
And it's all just down to that. And
is there data to show sort of how many people again are affected by pelvic congestion, men or women?
Because this is so new, we don't have all the data yet, and there's huge amounts of work being done at the moment. What we know is somewhere between 500,000 and 1.5 million women have either disabling or severe pelvic congestion. So much is affecting their work or affecting their social life or affecting their fertility. We know that if these studies have been done all around the world, and in every place it's been looked at. If you go to gynecology outpatients and you get them away from the gynecologists and you actually examine them, 1 in 3 women going to gynecologists with pelvic pain have got pelvic congestion, yet the gynecologists are not diagnosing it because they're not trained in it, and they feel like they're referring patients away. So luckily we've got Dr. Sophie Strong, who's just got a consultancy. She's just setting up our female pelvic pain unit because she's qualified in endometriosis and pelvic congestion and adenomyosis. So she's the first person who actually understands the difference between these different...
Yeah, and again, it goes back to seeing a specialist, and it's hard, and I think we need to probably have more conversations about venous health and the health of your sort of vascular network, because otherwise, again, people do think, well, it must be cystitis, it must be IBS, because it's in that area, and we actually need to remember, to your point earlier, the veins go everywhere. Yeah. And so we really do need to see somebody who understands that. Final question, is there anything that we can do ourselves, I mean, from a movement perspective, a nutritional perspective, even a sort of preventative wellness check perspective, just to stay on top of our health, of our veins?
So what we understand about veins at the moment is if you get venous disease, probably comes down to who your parents are, and you can't change that. You can't change that very easily. You can legally, but not genetically. So you'll get the propensity to get venous disease because of your genetics. However, what we do also know about it is if people keep active and healthy, then they actually get symptoms later and they get problems later. So movement is your great friend, and that's what makes the veins move. Also, early diagnosis. If you think you've got a problem, it's better to get it sorted earlier, because once you've started losing your valves, you can't actually, there's nothing you can take, there's no supplement or anything, it's a physical problem, and you've got to address that. So one thing that is very interesting, though, we do know that if you do want a nutritional advice, although it won't reverse varicose veins, you can reduce the inflammation in them by eating things with flavonoids in them, so micropurified flavonoid fraction, and there's some really interesting things on things like blueberries, and I only found out today a berry called ACAI. They're full of antioxidants, full of flavonoids, and they're very, very.
And the acai bowls.
And there's actually research papers done. And if you look at the surface of the cells in the vascular tree, they've got this thing called glycocalyx, and the more illness you've got, the smaller that glycocalyx gets. And if you take flavonoids, you actually grow that glycocalyx back. So there's a sort of difference between the inflammatory and cellular side and the structural. Once you've got structural, you need to see someone who can fix it and look at all different things. But keeping healthy I think these flavonoids are very good, but exercise is your big thing.
Well, the two approaches go hand in hand, don't they? And I think we say this in every facet of health and wellness. It's one thing going into the clinic and having the treatment and seeing the consultant and the expert who really knows what they're talking about, but then you also have to go home and do your homework, and that's sort of the balance in being well, ultimately. Amazing. Thank you so much, Mark. That was fascinating as always. And any questions for Mark, we'll come to those at the end. Our final speaker is Dr. Bevin McCartan. She's introduced herself to you, but Bevin takes a very longevity-focused approach, I would say, to sport and exercise medicine, which is fascinating. And it's a very female-centric approach. I've said this to you a few times as we've been in discussions, and I'm sure that will come to light as we start talking. But Bevin, you mentioned that your background is in professional sports, but what exactly is it that you're seeing from clients now that you've moved here? I know it's only been 2 months, but since you've come over to Lanserhof, are you seeing similar concerns from a physiological perspective, or are we sort of different to the athletes maybe from your previous world?
Yes, so I think we're quite different because I was dealing with young men, so it's slightly different clientele.
That's
here,
why this is a holiday for you.
Yeah, exactly. And even then, you're thinking, are these treatments useful for them now? What are you doing for them in the future? What will their health look like when they leave the club or ultimately leave their career? And I think here it's nice because we've got the time to have an individually led, tailored approach to the men and women that we see here. And I think I'm obviously lucky to have done men's professional sport for a while, but I did women's sport as well back previously. I worked with England Women and also with the RFU on performance optimization, and worked in Premiership Rugby as well. So I've been lucky enough to come through at a time when women's health was at forward focus, or we were trying to learn around what it was that we needed to work on or what we needed to improve around women's health, because the funding and investment just isn't there in the same way that it is for the men.
And when you do see a female patient now, what are they coming to you for? Sort of how do you work with them, and what are you really helping them to fix, I suppose?
So for men and women, what we'll look at is there's various aims. It depends on the goal that the person has in mind when they come to me. Sometimes they're very active and they've got injuries that normally we will deal with, but I'll also take a holistic approach to looking at their lifestyle and other factors around their life that might have implications on their musculoskeletal health. And then some people are coming with a goal in mind. They want to get fitter, or they want to improve their health, or they want to live longer, so they're looking at preventative measures. And really it's about tailoring that around your lifestyle and the realistic approach to what you can do within the busy lives that everybody has when you live in.
Exactly. How do you go about making that initial diagnosis or assessment when you're presented with a new human body? What are the first steps that you take to really get to know that body and, I suppose, put them on the right path?
Yeah, I think hearing my colleagues speak is quite nice, because we all have a holistic approach, and I think that's really important. I think as medics, we were initially treated that you specialize in one particular area and you only see that area, and that's the area you deal with. And actually, as we're seeing, hip pain can be pelvic congestion syndrome, it can be menopausal symptoms. So you get joint syndromes associated with the menopause or perimenopause. A lot of people will get unnecessary joint replacements or injections that maybe could take a slightly different approach if approached from a different angle. So tend to do a holistic sort of pillared approach to lifestyle and what people are looking at from previous musculoskeletal injuries, because that has a biomechanical effect on the rest of your body. Your general medical history, and then what you're like at an activity level point of view. And then I tend to do a full-scale assessment just of how you move, and then your spine, and then looking at your joints and any specific joints that you might have concerns about.
And when you're thinking about longevity, what are the sort of areas of the body that you are really focusing on? Like which muscle groups do you need to, I suppose, strengthen to really build that future-proofed body?
So the two things that they've proven that you need in order to live a longer life is grip strength and leg strength. So they're the two things that, and people think about living longer, but actually it's functioning for longer. So what keeps you out of the nursing home, what keeps you out of a wheelchair, what stops you needing a little walking aids and things like that. So actually, if you've got stronger grip, you're going to be able to do things for yourself more. You're not going to need carers. You're not going to need people to do assisted living for you. If you've got stronger legs, you'll be able to mobilize more. You'll be able to go out, do your own shopping, do your own chores, do your own work. So it's about aiming to sort of keep people stronger in that way. The other bonus you have is that when you're building muscle, your muscle secretes certain factors that are almost like stem cells. Mm-hmm. So they actually create new brain cells. So they create brain cells in your hippocampus, which is your memory center, so it keeps you functioning cognitively for longer. They've proven that racket sports in particular are really good for your neural development. So it's about not only keeping you fit and healthy, which is the superficial aspect of having muscles and looking great, but also then functioning for much longer, so you're not a burden on yourself or the environment or ultimately the population.
Yeah, and I guess stress as a concept gets thrown around so much, and we've sort of dipped into stress sort of manifesting in the body in so many different ways, and it strikes me that certainly exercise is so amazing for stress relief, but you must see it in a lot of the clients that you treat. If their stress is left unchecked, it can obviously go on to have a very detrimental effect on the body, physically and mentally.
Yeah, so stress is huge in that ultimately what we've realized now is that most disease, cancers, strokes are all related to your metabolism in some way that's not functioning. And actually, if we can look at what causes that, it's generally inflammation or chronic inflammation in your body. And what causes chronic inflammation? Stress. And so actually, it doesn't matter what kind of stress that is, if that's going on for a long period of time, and if it's left untreated, it can lead to or can progress disease. We know that in women, there's been studies coming out that people have probably seen, but repressed anger causes autoimmune disease, particularly in Black women. And actually that's basically emotions that have been left untreated and will be causing stress internally within somebody. And that's actually been shown now that it causes
and probably so much of that goes back to the fact that people are sort of, well, women in particular are wearing so many different hats and trying to do so much more and be accountable, and often they are the primary caregiver, and you know, it's almost this pressure cooker that builds up, I suppose, and then we wonder why at the end of it we're unwell and we're run down and we can't shake that cold, or you know, it's, you know, the diseases or the degeneration is getting a bit more weighty.
Yeah, exactly, and exercise can offset that, and it doesn't matter what exercise it is, and whether it's 10 minutes or whether it's an hour, anything is going to reverse that 1 hour of stress by 3 hours if you do a bit of exercise. So it has a bonus effect on your body, no matter how small or how long you're doing that exercise for. And I think if you look at lifestyles, all people need is just a certain period of mindfulness where you're doing absolutely nothing and you're taking time out for yourself, where you don't have to think about chores, you don't have to think about the normal mundanities of life. And if you can do that for yourself, not only is it really good because it actually cerebrally refreshes you, but you're then actually building muscle or building strength or longevity that will sustain you through life.
I was going to ask you if there was a single sort of exercise or mode of exercise that women could be doing from a longevity perspective, but I think you answered it because you sort of said, you know, that there is no one thing. It could be anything, I suppose. But
yeah, what I say to clients that I see here is that a lot of the time they're traveling or they're really busy. Realistically, you can't get to gym if you finish work at 9 p.m. or if you're traveling a lot or you've got to get home to children. You can do things like, while you're making a coffee or a tea in the day, 10 squats doesn't do anything, but actually you're building muscle while you're doing that.
And it's 10 more squats that you probably otherwise wouldn't have done because you would have excused it as not getting to the gym in time.
Exactly, and if you're taking a call, just stand up, walk around the room while you're taking a call. So it's very, very small things, but while, you know, it's just about building those small things up so they become habits rather than feeling like, I've got this chore, you know, she's told me I've got to do 1 hour of exercise, I'm not going to be able to fit this in, and then you see it as another thing on your list of things to do, which then becomes a negative, which
It becomes another thing to get stressed about, doesn't
Yeah.
it? And what about menstrual cycles? You spoke to me about this before the event, and you said actually it's sort of understanding where you are in your cycle often that's really valuable to women when it comes to approaching training from a longevity perspective as well, which I found really interesting.
Yeah, so it's really important for women to empower themselves or be their own advocates in health, because I think it's something that's pretty much been underplayed in medicine for a long time. And actually, if we learn menstrual cycles, the majority of us don't learn about our menstrual cycles until we're in our 30s, and by that stage you're already about 20 years in, and you sort of wonder why you didn't have this knowledge when you were 16. But actually, we have a cycle that sort of a few hormones, but there are certain parts of the cycle that have been shown for most women, or the majority of women, that you will have pro-inflammatory phases with your early follicular phase, which is the start as you're building up to releasing your egg, and then also your late luteal phase, which is just before you have your period. And actually, if you can learn that your body's more likely to be a bit more inflamed, a bit more stiff, you're probably a bit more irritable, a bit more fatigued, maybe not sleeping as well. It's about training smartly around managing those symptoms and what you can do. And actually, in those times, it's probably a time not to be trying to do fasted exercise, not to be forcing yourself to do HIIT classes or to do high intensity cardio. It's about doing movement that actually will align with keeping your body relaxed and in that relaxed state, and being kind to your body then.
I think you hit it on the head there. It's the kindness to your body, and it's also understanding your body and becoming more in tune with all of its various cycles and rhythms and nuances. And I think once we can cultivate that and create an awareness of that, then that stands us in much better stead. I wanted to ask you about all of the sort of biohacking or bioharmonization, as I know they're sort of being rebranded now, facilities that you have here at Lanserhof as well, because you do the cryotherapy and you do ozone therapy and hyperbaric oxygen. Where do those fit into the picture when it comes to sort of creating that body for the future?
So, I mean, we're really lucky here. Basically, the stuff that we have here, we would have had in our, in any Premier League football club, which is ideal. And actually, they're being used for a long time in the performance aspect of elite sport. But cryotherapy does help with reducing inflammation, and it does speed up healing if that's what people use it for. Again, with ozone therapy and hyperbaric oxygen, it's been proven in the NHS, which is, really, we look at, in the UK, we look at level 1 evidence, but I think these types of therapies are less concrete in their evidence base, but actually we've shown that they're of benefit and they don't cause harm, so they're all really useful adjuvants.
So many surgeons are sort of advocates of hyperbaric oxygen now to sort of prepare the body and recover after their procedures now as well. It's becoming quite commonplace.
Really good for recovery and really, really good for accelerating healing. So, and doesn't cause any harm, so it's a nice thing to do. It also gives you a bit of time out because you're in a little bubble and you can't do too much, so it's a nice excuse to have,
Whereas the cryo is literally like 3 minutes in there, isn't it? So that it's the most efficient therapy you'll ever do.
Yeah, it's a lot better than cold water immersion, and it doesn't carry the risks associated with cold water immersion, where so it's nice, and your whole body is in the cryo, so it's quite...
I didn't realise there are risks associated with that cold. I mean, it makes sense, but the cryotherapy is the, call it, safer option then if you want to do that cold therapy?
Yeah, so cold water has the joy of activating both of your nervous systems. So you've got your sympathetic and your parasympathetic nervous system. One wants to speed up and freak out, and the other one wants to slow down and stop. And so actually, if one takes over the other, your heart can stop. So it's one where I think I prefer to do cryotherapy than over cold water immersion. It's also much nicer, I think, because you can jump apart while you're doing it for 2 minutes.
You can listen to your own playlist in there as well, which is always quite joyful. I mean, is there an argument that these sort of performance enhancing sort of therapies are also triggering stress in the body, but actually it's a good type of stress potentially, and sometimes we do need to not demonize the stress and say the body does benefit from a little bit of stress from time to time to really perform at its optimal.
Yeah, and I think things like cryotherapy are done in a healthy, controlled way where you will get a little boost, and then it speeds up your body to produce all the factors that will help with anti-aging or with longevity. I think it's more about, like you said, it's knowing what's healthy and what's not. We ultimately, if you look at your, I'm wearing an Oura ring, but if you look at your wearable devices, you'll have those types of periods where they'll say, oh, you're under stress, but you might have been at the gym, or you know, it's certain amounts of stress are healthy, but it's that chronic stress state that is what you don't want to be in.
Yeah. And final question on the wearable devices and the rings and the trackables and the whoops. Do you find them of value when you're sort of treating a client, a patient, trying to get them back onto a more sort of future-proof sort of plan?
Yeah, I think we're lucky because we're in an era now where we get a lot of data and we collect a lot of data around ourselves. I think it's really useful. I think it's really useful to educate yourself on your body and what is normal and what isn't. I do find them useful, but I'm used to using a lot of the data from a performance aspect for elite athletes. I think it's about not hyper-focusing on it or not using it as a health anxiety or a health state. It's like trying to meditate and stressing because you can't sit in silence for 7 minutes or whatever it is that you're trying to do. But as long as you're using it from a utilization point of view and you can see things like your heart rate variability, which is a really good marker of what your heart's general health is like, or your VO2 max, which again is your cardiovascular response and how healthy you are from a cardiovascular capacity, are quite useful to know, and the things that you can improve on, so you can actually look back over your year and see how you've improved.
How coming to Lanserhof and doing the cryotherapy has improved you?
Well, we've also got a really good performance lab with a lot of spinal analysis, data analysis. We test core and we do rest and metabolic rate, which is a scary education on how much you should be eating. And then we do a VO2 max test. Do you know what it was? I had it done on myself, and I thought it was really, really useful learning. But yeah.
I guess we can always be learning, can't we? But yeah, you're right on the data front. I think, knowledge is power, but you have to sort of keep that in check and in balance with, seeing the specialists, talking to the experts, doing the homework as well, and everything just has to be in balance. I mean, we can't say it enough. I think no talk goes by without us probably saying that phrase. But yeah, very, very interesting to hear from you, Bevin. Thank you very much. I think that brings us to the end of tonight's conversation. And I don't know if you agree, I found it really interesting listening to all three of you and seeing how you overlap so beautifully. And there's this saying that form follows function. And I think it's so true when I think of how all three of you work. I think all of us probably want a body that looks great on the beach in the summer. I know I do, definitely. But it strikes me that as long as you're sort of addressing all of these things, that having a pain-free body, a stress-free body, an inflammation-free body is really what's going to look great, but also stand the test of time for you, in addition, of course, to seeing the best experts and consultants. So thank you, everyone. We do have time for some questions at the end. If you do need to scoot off, please don't forget your goodie bag. I think they'll all be waiting outside for you. And if you'd like us to connect you with anyone, then just you can leave your details on the referral card and we'll make those connections. But were there any questions, any brave questions? Yes, please.
Yes, about sort of full body scans. I see various topics on Instagram about doing that, and celebrities are endorsing it. And I'm just curious about your thoughts, any of your thoughts about that. Does it create more anxiety? Are there false positives in those body scans? Is it good to do it as a preventative measure? Or are there problems with doing that? Does it create more problems than it solves?
What do you think? I think, like anything, it's really important where you're getting it done, and actually what you don't want to do is get a full body scan, somebody hands you the results and you walk away thinking, what is this? And we do them here, and I think the bonus is here that we interpret them, and I think it's really important that you get them interpreted, because actually you need to know firstly what are they looking for and why are they doing it and what are the reasons for doing it. If you're doing it looking for cancers or any concerns that might arise, that's fine. If you're looking at it because you want to look at your musculoskeletal form, that's good. You can look at it from a body fat composition as well, but I think there's a lot of places out there that are promising these longevity scans or prevention scans, and actually really it's what they're actually looking for. Is it body composition they're looking at, or is it they're looking to detect cancers for you? And if so, what are they going to follow up, for you? Because I think it's really important that you get that level of care afterwards.
I agree. I think the follow-up is really key, isn't it? Somebody to actually go through that and explain it to you. Sorry, Mark.
No, sorry. If there really was a scan that could pick up everything, then we wouldn't have radiology departments, haematology departments and everything else. Every hospital would just say, we'll put you through a whole body scan. So it's unfortunately, we spend huge amounts of time at medical school and all the way through in scientists getting new diagnostic tests for things that we can't already find, and we know there's false positive, false negatives. And when you have a company that sort of picks up one scanner and just says we're now going to promote it, you've got to sort of be slightly worried. I think what happens is if they turn around and say, look, what we're going to do is we're going to look at your muscular mass or something, fantastic, you get the right scanner for that. If you're looking for other things, in my word, venous disease, well, we've got about 3 different sorts of tests for the 3 different sorts of venous disease we look for. So you have to have specific tests to look for things. So therefore, there's no one screening scan that's ever going to tell you everything. They're really just looking for either space-occupying lesion or something you can see on the scan or something. So you might see something, and then quite often that might just be an incidental finding, and you might be then worried well. So I think what you need to do is if you sit around and say, I actually want to know, is my heart functioning properly? Am I as fit as I think? But if you've got a question, I think they're brilliant, absolutely fantastic. But if you sort of come out and it says, oh, it's all looking good, don't think you've been given a clean bill of health for bladder cancer or something else.
Or if there is a specific concern, then go and do the test that is very specific to that versus something that's a bit more generic. And yeah, is that helpful?
Yeah.
Amazing.
Would a Doppler scan pick up a venous, a pelvic congestion?
Sorry, which one?
A Doppler scan?
Yeah, so absolutely right. So basically, in females we've sort of sorted it out now, and we invented the scan at the Whiteley Clinic called the Holdstork-Harrison protocol. And what happens is most women, unfortunately, go to doctors who don't understand it. They have MRIs or CTs, or they lie flat. And you'd fail at medical school if you examine veins lying flat, because veins that don't reflux if you lie flat. Yet all of these tests do it. So you have to be either erect or you have to be at 45 degrees. So for women, it's easier because we can do a transvaginal scan. You can put the probe right next to where the problem is. If you try and look across the abdomen with the Doppler, you've got bowel in the way, but also you can't see deep into the pelvis. So you have to get into the pelvis. So if the lady's able to have a transvaginal scan, we can get incredibly accurate results from that. We have problems with ladies who either don't want it or can't have that, and we have problems with men. Men are just a nightmare at the moment, because their pelvis is actually more complex than the female pelvis. The female pelvis is a bucket and everything's inside. As males, half of it's a bucket and half of it's just falling out to the front. So the fact that testicles hang out means they drag all the pelvic veins and arteries with them. So we're really struggling on the male pelvic side about the right imaging, and there is no one imaging that is perfect. But the other thing is, although for cancers and things like that, you want to see is there something there or not, we want to see function. So some of our tests don't image at all. They literally are lying you down, taking a pressure measurement or a volume measurement, moving in a certain way and seeing how quickly it changes, because function is far more important for venous disease and arterial disease than anatomy.
So you may know this Professor Alan Davis?
Yes.
Yeah.
Very
I've
well.
been seeing him actually.
Well, Alan's an artery surgeon who
Yeah.
does some veins, and that's one of the
I saw his
the
card.
things. It's really, really important that we keep promoting the venous as a speciality, because it's a totally different pathophysiology.
Were there any other questions? Hi.
So, question to Dr. Bevin.
Yeah.
Sorry. First of all, thank you all really for an amazing talk. Probably got a million questions. But I just wanted to ask about training women and how different approaches you might take to train a 20, 30-year-old woman versus a postmenopausal woman.
I don't actually think it differs too much, in that even when I was dealing with elite female athletes in jumping sports, around 20 of them had leaks, urinary leaks, and they see that as normal. So actually, it's really important that women look at their pelvic floor, look at their pelvic stability. It's the same with men. If we're dealing with an injury around the pelvis. In a man, we will also address the pelvic stability and pelvic strength too. And then it's the only difference would be looking at where they are in their cycle and what implications that would have, because the more we go towards perimenopause and menopause, you may be getting joint or musculoskeletal issues that may or may not be related to hormone production or lack of. And so then it's important to have conversations around that.
Is that purely the breakdown of estrogen affecting collagen in the muscles?
So estrogen is something that's really really complex in a woman, and they don't actually know what it affects. It has effects on vascular health, so that's why women are more prone to coronary artery disease when we lose our estrogen. It also has things like we have estrogen receptors in our ACLs, which obviously men don't, and so actually we will have more tendency to rupture if we are fatigued through certain aspects of our cycle because of estrogen. Lack of estrogen increases inflammation in our body, so it's actually really important. Again, estrogen dominance can also cause issues, so women with PCOS or PMDD will also have other factors, so it's really complex, but it certainly has an implication on they say not stiffness, but probably pro-inflammatory states around your musculoskeletal health.
It's such an interesting approach, sort of being so mindful of your cycle and almost being guided by that somewhat as to how you approach, what you do in the gym or sort of your own training. I'm interested, Aggie, does that ever come into play with the aesthetic treatments that you do when you're looking at people's skin health, maybe some of these pelvic floor tightening devices? Do you again have to be sort of mindful of where somebody is in their cycle?
In the cycle, in the perimenopause, obviously,
Yeah.
journey,
Yeah.
in the inflammation journey, because it could be someone who's quite young and but still has a very high level of inflammation, and they will respond differently to certain treatments and will have a completely different needs in terms of what treatments we need to prescribe. So I think inflammation and which is closely linked to estrogen, obviously. Those two things are very, very
It's just a great thing as a practitioner to obviously be aware of as well. Mark, does it come into your world with pelvic congestion?
Not really, not what I've found, but just sort of on general academic stuff in the past. It's fascinating because when I was going through the academic sort of training I did, there was a lot of interest at the stage that if you have a breast cancer operation, your survival depends on what time of the month you have it.
No,
really? It's huge, yeah, there's a huge thing. It's from a guy's hospital, and so they were timing certain breast cancer operations at different times of the month.
Is that well documented? Is that something that's actually
proven.
made it into...
Absolutely proven, yeah.
But that's made it into how people are now treated?
Yeah, absolutely. Okay. And so you do,
idea.
so if you, and that's also now come to, also, some of the tumours are estrogen dependent and some not, so it comes to whether you're then given tamoxifen and everything. But I think that's only scratching. That's just a proof of exactly what these two ladies have been saying. There's this huge thing that we don't understand at the moment. You don't have a stable body. I mean, the same way that you wouldn't suddenly go out and do a 26-mile marathon tomorrow, but if you train up to it, you will do. And so the same thing, if your body's fluctuating in a cycle, you're going to have better and worse times. But we don't understand all of them. And that's why I'm fascinated by some of the work that's been done.
I feel like we're just sort of at the sort of at the very beginning of that journey and understanding what that looks like. Were there any other questions?
I wanted to ask about vagus nerve and the gut connection.
Oh yes, that's really interesting. Aggie,
so I definitely see with LPG that just increasing the variable heart rate and heart rate variability and impact on the vagus nerve is going to reduce the cortisol, is going to help with sleep, with our immunity. It increases the level of lymphocytes T. So there is definitely an impact with which we can.
But with the cortisol levels, you might sort of encourage lifestyle changes like yoga, meditation.
Absolutely, of course, that's the basic thing. It's just something that we see on a very short period of time with just introducing, a few treatments, and we see it in a very small sample.
There are more and more devices now that are talking about vagus nerve and the stimulation of that, and
it's very difficult to tell someone who needs to introduce so many life changes, and it's so stressed about it. And the last thing you want to do is to stress them more about all the changes that they need to implement really quickly. So sometimes, as I said before, breaking the cycle, actually showing them, and sometimes people are so overwhelmed, it's very difficult for them to meditate, to focus, to calm down the mind a little bit. So those kind of physical experiences can actually help them to get into the routine and understand what kind of powerful impact it will
I
have
think,
on them.
People don't realise how important gut health is with the microbiomes, and I think a lot of people don't really call the second brain.
And it's all connected.
Yeah, of course,
It's all connected.
It's so true though, to your point. I mean, you have to balance the yoga and the meditation and everything, but it's sometimes very overwhelming, and I always found it very difficult to meditate. So sometimes finding something that doesn't sort of fit the bill of classic meditation, whatever you think that looks like, but maybe it is a treatment or it is a protocol or something, can be a really interesting way to address it. Did you have?
I was just going to say one other thing. There's been a couple of papers out recently which are very interesting, looking at what we need, and down to exactly what you were saying about the mindfulness and about the giving yourself time to think, because you have to have time to fantasize, you have to have time to daydream, because if you don't go through different scenarios in your mind, you don't come up with anything new, and none of us do anymore, because as soon as you've got some spare time, you take your mobile phone out and you look at social media, and we're destroying our downtime, and we're all feeling busier and more stressed because we don't allow ourselves to daydream anymore, and we don't allow ourselves downtime. And it's been one of the biggest problems, and there's this huge problem. You probably heard of male fertility's dropped. Male fertility's dropped massively, and testosterone levels are down like 35% across the world since the iPhone came out. And it's absolutely, birth rates are down. We're not even reproducing as a human race anymore. Reproduction
Just because
rate,
we've lost that connectivity with
Well,
one another because we're so tapped into the device.
we don't. It's probably not as simple as that. It's probably the fact that what's happening is men. You actually get so much satisfaction now out of just sort of emailing people, looking at social media. You don't interact. You don't go talk to people. Relationships
It's chasing
fall
those
apart.
endorphins that people are
Yeah.
so often now getting. It's getting that fix sort of over and over from a new email, a like on an Instagram, whatever it might be.
And also
There's
men,
mental problems now.
but also
Yeah,
male
absolutely.
testosterone's dropped dramatically because men have stopped doing sport because they prefer to scroll and they prefer to play video games. Testosterone drops, so fertility drops. And in the world, I believe the latest figures I show is each couple now are reproducing 1.44 children. So the human race is dying at the moment, and we're only not seeing it at the level because there's lots of us in the 60s, 70s, 80s who aren't dying yet. But the actual reproduction, we're not reproducing. And if you actually look in Japan, they've just produced their figures for last year. They're meant to have 2 million births a year, and last year there was 700,000.
Wow, that's
And we
massive.
are actually in stages at the moment of, if you listen, not everyone likes it, but Elon Musk was the first person I heard bring this out 10 years ago, when everybody else was saying, oh my God, they're going to hit 10 billion people, there's not enough food, there's not enough. It's wrong, absolutely wrong. We haven't got enough children. We haven't got enough people who are going to look after us in our old age. And the human race is dying out at the moment because we don't have enough young people.
And we're living longer at the same time. It's that.
This whole thing of male testosterone, I think this is why it's absolutely fascinating because we've got to get back to exercise, we've got to get back to good hormone health, we've got to get back to mindfulness, got to get back to all the health things, to get back to a society that's actually reproducing enough to stay stable.
That's why this is basically going to be our next talk, I've decided, just listening to you. This is such an interesting conversation to delve into a little bit more. Yes, always get great ideas listening, because I'm not scrolling on my phone probably. That's probably enough, I think, in terms of questions. I think I'm being given the time outside, but thank you so much to everyone for attending, to Lanserhof firstly for hosting us in such beautiful style. As always, it's really nice to come back here, thank you. To everyone here, it's been so wonderful having you here, and I hope it's been helpful, everything that you've learned from our amazing experts and specialists. And it goes without saying we'd love to have you back to more events, either here in London or in Dubai, where we now host them as well. So you can sign up at thebeachtriangle.com, or you can leave your details, and we'll sort of always make sure you're the first to know about upcoming events. And yeah, finally, thank you to our amazing panelists. We've learned so much, and it's been so eye-opening. So thank you. Thank you, ladies and gentlemen.